Now you said you had a separate person that was helping you with cognitive therapy.
Correct.
And what did the cognitive therapy consist of, and how is it different in speech?
Well, I was having some, I guess you would call them environmental issues, and a lot of them was, normal things that you can fix. But like some of my memories, if I parked my car, I couldn't remember where I parked it, and so we'd practice. I remember going on. I don't remember what holiday, but it was a video. We'd park in the mall, and we'd walk in the store, we walked around, I just had to find these different things, and we mapped them out ahead of time. Then when we were done, we'd walk out the door, and I said, all right, find your car. and the first couple times, I didn't do so well, but it's retraining yourself to remember. And then as far as the behavioral, coming up with like kind of just plans, for myself, little timeouts for myself, and I take them to this day. And I push myself, and everyone that I work with knows that if I don't call you back, it's because I'm overwhelmed.
What you're talking about is essentially relearning much of what you do as you become an adult. Do you agree?
Correct.
Excellent.
Well, one instance, I remember taking my daughter shopping. When a lady comes out and asks, does this dress make me look fat? You don't say, it's not the dress, ma'am. You don't, that's not the first thing that's coming, but those are the types of things. And being appropriate with people, not putting your thoughts out there, because what I thought is what I said. And I was always a pretty honest person, but it was to the point where it was hurtful sometimes,
Now that disinhibition, that lack of social appropriateness is a problem that can persist long-term for people after brain injury. How did you make progress from the extreme end of that to the point where you can function with people without offending people?
Well, it's questionable that I do that to this day, but no, I've just a lot of error. I learned by a lot of mistakes I made. You burn your finger on a burner a couple times. You hurt enough people, and you stop. And I hurt a couple close people, and so I made a real effort to watch it. And when I was in those positions where I was overwhelmed, it was not getting to that point for a good year. I had to just really limit, my exposure to things.